Is right.
November is National Cancer Awareness Month, and tomorrow, November 7th, is Stomach Cancer Awareness Day. So today we're on your side with Dr. Parikh, a gastroenterologist with the Birmingham Gastroenterology and did I say that right?
Yeah, Birmingham Gastro Associates.
Yeah, exactly.
There you go.
Got to shorten it sometimes. So when we're looking at this, first off, kind of give us the understanding of what stomach cancer really is.
Yeah, so I think the biggest thing for patients to know is stomach cancer is not of your whole abdomen, which some people call your stomach all the time, which is fair, but it's actually the gastric pouch, the actual stomach that holds your food and digests your food. And it's not a super common cancer, but it's a very lethal cancer.
Right.
And so being aware of symptoms is highly critical to catch things early. Our goal is to obviously catch things early and prevent bad disease from happening.
Yeah. What are some of those symptoms that we need to be on the lookout for then?
The biggest things are mainly abdominal pain, sometimes more so after eating, nausea, weight loss, sometimes bleeding. This can be either vomiting blood, obviously that's a bad thing, that should get everyone worried, but sometimes it's just darker stools, and blood digested in your stomach turns your stool dark or black sometimes tarry.
Yeah.
And that's something we don't want anyone to ignore, and kind of check in with your local doc, primary care, GI doc.
Yeah, I understand. Any type of cause that we can get our finger on?
You know, it's a great question. I think the most common causes in North America and the world is a bacteria called H. pylori. It's a common bug we see in the community.
Right.
It causes ulcers, but untreated ulcers can become cancerous over time. Tobacco is a high risk factor. Morbid obesity, which we're seeing more and more in our community, is not just bad for heart, lung, and stroke stuff, but bad for GI tract and cancers. And there's some other genetic syndromes we keep an eye on, but those are the big ones.
Yeah. What type of treatment is out there?
Some gastric cancers, the large majority, a small percentage we can catch early enough, and I can resect it with an endoscopy, treat it with H. pylori, antibiotic therapy, the really early ones. But most require surgery and some form of chemo or radiation.
Right.
So you have a kind of faceted team that takes care of you, between a gastroenterologist like myself, a medical oncologist, a surgeon, possibly a radiation oncologist. And we really work together as a team to make sure you get individualized personal care, because everyone's a little bit different.
Yeah, well, you mentioned causes or possible causes. Is there anything that we can do to limit the chances of us maybe?
Yeah, it's a random genetic mutation that happens when you get these kinds of cancers. So we don't control all of it, but I think avoiding tobacco, alcohol, eating a diet that's heavier in vegetables and less preserved meats and preserved foods and processed foods is probably the best chance you have of preventing a disease like that, along with a number of other cancers, not just gastric, but a lot of other cancers as well.
Without a doubt, without a doubt. We appreciate your time, Dr. Raj.
Yeah, my pleasure.
Most definitely, and we've got plenty more still coming.